Hi, everybody. My name is Ashley Birch, CEO of ABC Medical Center. I just wanted to talk with all of you guys about this new EHR system we're going to be incorporating into our company. And I really love this system mainly because there's some different functions and things that are going to be able to help us continue to make sure our patients are being taken care of. Some big advantages during that I'm going to talk about during this time is one, patients are going to be able to remotely access their health records, whether it be them trying to get images done or trying to look at the results of their lab work, things kind of like that. Um, this EHR system is going to allow us to get fast access to these things where times are going to come up we need them right away. We're going to be able to securely share this information with our patients through patient portals, social media, that kind of stuff. We're going to be able to enable our doctors and nurses to be able to do prescribing, and where medication errors are going to drastically go down because of the increase in charting electronically without the trouble of handwriting and everything like that. So this EHR also enhances our privacy and security for our patient data. So patients aren't going to have to worry about, is my information going to be safe with this system, is that kind of stuff. So it's also going to decrease a lot of our paperwork processes that we currently are having right now. All in all, it's just going to be able to increase our processes and making sure that our time is being more towards the patient and not making sure all the data is in their patient records. I just want to talk about a couple functions of this EHR that we've decided to go with. It's going to basically replace all of our paper records that we currently have, and we're going to, like I said before, we're going to be able to get rapid access to patient lab results, x-rays, all of that kind of stuff related to patient results. Also, it's going to decrease our medical errors in that with paper records, we have to take time in making sure that everything is going in the correct patient chart, that kind of stuff. So EHR is going to basically keep everything electronic, and that we don't have to take as much time going through each single thing of a patient's paper chart to make sure that it's going in the right slot and all of that kind of stuff. Within our EHR, we're going to be able to review lab tests and radiology reports, that kind of stuff. And this is basically going to really increase our workflow and decrease our errors, like I said before. EHR is also going to be able to flag duplicate medication errors or suspicious of duplicate medication errors, and that's going to really be able to, another thing, decrease more of our medications. Another thing is going to be patient support, which is very important with patients that are in chronic conditions, and where there's going to be a library connected to our EHR that is going to allow patients to get into and basically kind of go about tips on um, um, tips on their condition, things that they could do, maybe to talk to their doctor about, different questions they might have. It's also going to talk about possible telemedicine, and that will be easier on them for people that may, or say, stage 4 cancer or something in that aspect where they're unable to come in and talk to the doctors in person. It's also going to help in our decisions support for our doctors, in that it'll alert them and remind them of certain things, and also have computer assisted diagnosis and treatment. And by that I mean it'll be send reminders for this certain patient, stating that they are able to do go through preventative stages for a certain disease, or maybe an alert that comes up from a doctor prescribing a certain drug and that it could have an interaction with another prescription that this patient is currently taking. It's also going to help the doctors diagnose patients that have complex conditions. And it's also going to flag some treatment plans and orders that may not be able to adhere to the current guidelines. So just a couple of things there. Other things that I would like to talk about also is the benefits of using our social media aspect route and benefits of the personal health records for patients to be able to interact with us and our company as well. We have already started implementing social media into our company to help us kind of excel. And implementing the social media aspect into our company is going to really enhance our services and provide our patients with accurate medical information. One thing that we have currently already kind of implemented is using social media for our current training processes, in that we're using different presentations and apps and that kind of thing to train a new person coming on board, or current employees training on new things that maybe they need to be updated on, that kind of stuff. Some different ways that and routes that we would like to go through with as far as social media is using different things as far as being able to give to our patients if they have questions about a certain medical condition or certain news about outbreaks or anything related to health outbreaks and that kind of stuff, health hazards in that route. Another way we'd like to utilize our social media to our company is we want to be able to evaluate our competitors' services, and that we're trying to be the best that we can. So that way our patients have somewhere they trust and a company that they feel they are being taken care of. And in turn, this is all going to be able to increase our patient satisfaction and overall improve our patient care. Another thing that is going to contribute to this is the personal health records, and that patients are going to be able to get access to all of their health records, and specifically if, say, there is an emergency that has happened to this patient, this personal health record is going to allow us to give this to the first responders that come in, and they're going to be able to see the diseases the patient may be being treated for, medications that the patient is taking, drug allergies, that kind of thing, which is really going to help, from our care to another doctor's care, be able to take care of that patient. Another thing that is really coming big with, COVID-19 happening is something called mHealth technology, also probably better known as telemedicine, telehealth. It's kind of all contributed to the same thing. This basically just allows our patients to give better access to providers and their care mobily without having to come into the office and have an in-person visit. This also will allow our patients to send secure messages to our providers, maybe schedule appointments, just be able to connect our providers 24/7. And I know from personal experience that most patients love this kind of convenience because of the fact that they may not be able to get to an appointment, or they love the ease to be able to just grab their phone and talk to their provider and not have to worry about missing an appointment, that kind of thing. It's also going to improve our medication adherence, in the fact that once patients are discharged, say from the hospital or a different medical facility, it's kind of tough to know they're going to know how to take their medication. They're going to know how much to take of their medication. And with mHealth, there are apps out there that we would like to implement into our system and let our patients know, just so they have that to refer to on, say, they run out of their medication, and then this will automatically give an automated message to have their medication refilled, that kind of stuff. So just a couple of things that talking about here that really could improve our overall patient care, and I believe that will help our company excel and should be used on a daily basis, for the fact that it's going to make our patient care person to person better, rather than saving our time making sure things are filed, making sure things are correctly documented, that kind of thing. So, and as things progress, we'll be coming out more with different videos on processes that will help this go through the better route and everything else like that. So any questions, comments, concerns, you can always bring it up with your supervisors, that kind of thing. But I'm glad I was able to talk with you guys here today, and just kind of let you know the new process that will hopefully be able to excel our company. Thank you.